Right, consultation today. Health. Don't know which number this is. I think it's number 4. But anyway, now this is a bit of a situation here, because as we know, we're probably one of the only countries with a free health service. There's various parties that think it's great to privatise literally everything. So eventually, if we carry on the way we are, it's going to be privatised. And then what tends to happen with contracts is, it's a nice low figure to start with, and that person wins the contract, and we all think great. But low contract, what does that mean? Bad. You know, they're obviously not going to spend much money on the thing they're contracted to do. Obviously, because they've got to save the money. So you know, you pay for what you get, basically. But anyway, I'm saying we shouldn't pay for anything. You shouldn't have to pay. If there's a problem with health, all humans should get together, move in, and solve that problem immediately. Not have to give money to a charity because the health service can't afford it, like cancer research. That's that's stupid, isn't it? What's charity there for? Because the government can't afford it. So, and not only that, there's a lot of people making a lot of money out of the charities. So, basically, I can see the lights in my glasses. So yeah, so what we'll do, health. National Health Service. Begins on the 5th of July, can't remember which year, doesn't say there. It's not a charity, it says. That's a good one. Anyway, people of the earth, because we're split up into country system, I've got country systems coming up on one of my other subjects. Because we're split up into countries, poor countries, people die, rich countries, they don't. Very rich countries who haven't got the health system, they're still dying. And I heard the other day, I mean, there was a YouTube video trying to guess, British people trying to guess on the street, as an interviewer, how much people in America pay for stuff. $25,000 for caesarean section. You know, where's that $25,000? It's only a man there with a scalpel. Where do you spend $25,000? Somebody must be taking the mickey somewhere. Now, you go into NHS hospital and you have an operation and it's great, that's free. And somewhere down the line you learn that it was £28,000. When you look at the operating theatre and the people in it, and the electricity used, and the swabs, and the electricity to you know, all these little things do not add up to 28,000. Now, you know, somebody somewhere is taking the mickey. Now, when I was a postman, some of the bigger houses on my route were surgeons. So, you know, okay, fair enough, they're doing well. But what I want here is for people to comment, to say, you know, where's the money going? There's obviously the drug companies, we know they take the mickey already. The equipment companies, some of the equipment, a scanner, £500,000 for a magnet that rotates. You know, I'm just trying to work out where this, who's taking the mickey. It's like in the MOD, we've got companies that charge a fortune for stuff. Give you some example, the little radios that go here on a soldier, the H4855, I think we call it the PRS or something, personal roll radio, that's it. They're about 800, between £400 and £800 each. When they got released from the MOD, there was some with bad circuits, that got released, they got sold for 50p. Now, in China or Japan, they could make that for a fiver. You know, probably a better one with more range, because the range is rubbish. We've had them round here, and when you go behind a building, they cut off. You know, they're just not. And when you get these, which are only 70 odd pounds, you know, they go for miles. So that's the kind of thing we're talking about. Somebody thinks, oh, we're the only people who produce this. We're a company, we've got shareholders, we need to make money, we're going to put it up. Look at that chap in America who bought the patent for a drug and then put it up by 1,000%. Because it was then his, he said. You know, I'm not sure if he was killed or not, but I'm pretty sure he can't leave his house. So yeah, this is a situation we're in. What should happen is, and you know, we should have a centre of excellence for every disease. You go to the doctors, he says, oh, you've got pneumonia. Go to centre of excellence for pneumonia. You go in an indoor, and you don't come out of the outdoor until you're cured. And they deal with you immediately. None of this, oh, let's make an appointment. Oh, you have to make an appointment. Oh. No. Straight in. People there waiting with gloves on. Grab you. Put you in a bed immediately. And start work on you. If you need to have a big carousel with beds on it, come in here, go round on the carousel and come out there. Fair enough. But that's what you do. You know, we're humans. You are a human. If you want to be in the health service, which is a seriously admirable thing, one of my own friends, I knew her from a little baby. She became a doctor, and she said it was just hell. In fact, she went to Australia in the end, because the NHS service here was just hell. You see, now they're all trusts. They need to get as much out of their staff as possible. So the nurses are working God knows how long. The wages have been squashed down. The only people who seem to be doing any good are the very high qualified specialists, like surgeons and things like that. Yeah, so the drugs are too expensive, the equipment's too expensive. You know, what should be happening? There should be no money involved. You know, if somebody wants a scanner, you put it on your mobile, the scanner company reads that, builds a scanner and delivers it. No messing about. You might say, how do they get... well, you'd have to see my other YouTube video on money, which is in the Project X section under UFO. The UFO one. But basically, everything's done in centres of excellence. And once you've delivered the scanner, all the staff get to go closer to their centre of excellence. Or tax money pays it at the lowest, you know. But much higher, obviously much higher wages because of the service involved. But yeah, so you know that there are ways round it, and there are systems that we don't use because it'll mean the rich becoming on the same level as all of us. And obviously they don't need that, but I can tell you how that works later. Yeah, what I want in this consultation is people to I'm going to leave this running for a couple of years. People to say what they've witnessed. I don't want any... okay, if you've been in hospital and had... You know, most people who go into hospital have a great experience and everything's fine. But so yeah, the odd patient may be, but mainly equipment sellers, drug companies, and people who actually work in hospitals and doctors. You know, like say for instance, one of my friends used to go around selling drugs to doctor surgeries. And he would give them an incentive. Now, what does that mean? That means that the doctor is going to push that drug to get the incentive. He's going to start giving it out. Willy-nilly, you know. Yeah, I have one of these. Oh, you need one of these. You know, what's that about? And they know the more of one particular expensive drug they can sell or push, the more money they're going to get. That's not right. And some of the stuff you see in gimmicks and things you see in doctor surgeries, you know, are just, don't know. Anyway, I want to hear from the doctors. See what exactly is going on, basically, and then we'll report. There'll be health, and then there'll be update, and the date, so you know when's when. So yeah, what have we got to? We've got to. Let's see what that is. 40. $10. God, that's only 10 minutes. Looks like a 4 to me. But yeah, these aren't very long, these consultations. So well, that's it. But what I'm saying is, you know, for instance, my wife's mother, living in a foreign country, died because they had no money to put her into a proper hospital with, you know, which took money, basically. Okay, in some places, like for instance, my wife went in for a filling in one country. You had to pay, there's no NHS or anything, but it was £5. You know, here, even with the NHS behind them, the dentists are you know, charging you amount on top as well. Probably because the government won't pay it, but generally it's something to do with the fact that they might be greedy, you know. And obviously, being a human, you always want what you haven't got. So if you're on 20,000 a year, you're automatically pushing for 30,000 and 40,000. So if you own your own company, you virtually pay yourself what you like. But it's got to come from somewhere. It's usually from your clients. So yeah, the money system is has to go, basically. That has to go, and I'll talk about that at some stage. I'll talk about the centres of excellence, which is the replacement for money, which the government do know about, but obviously once you become an MP and you're on 70, 80,000 a year, you don't, you know, you're automatically made a rich person overnight. So they're not going to want to change that. So basically, yeah, that's all nasty stuff. You know, here we've now got ambulances that take a long time. Although they're doing a fantastic job, not enough of them. Massive long waiting times. You know, what you do really is if you've got waiting times for a certain operation, you build another operating theatre and take on more staff to deal with it. Very simple, isn't it? But because they've got a budget, they've got to stick that budget every month or whatever. No, there's got to be a waiting list. Budgets. That's another thing. Turning everything NHS trust, you know, what's behind that? All I can see is the fact that the fat cats running the trust are getting massive wages. That's all I can see. Those wages have got to come from somewhere. You know, like the charities are the same. They reckon only 2% of, I'm not sure about the cancer charities, but only 2% actually gets to the actual cause. The rest of it's used up in paperwork, offices, fat cat salaries. You know, there's some woman was getting, I think it was a cancer research, was getting 230 odd thousand a year. You just do not need that kind of money. But being a human, wanting what you haven't got, is part of our survival system, still built into our head from years ago, millions of years ago. You know, I now want 300,000. You know, same with the MPs. MPs, well, they're tripling percentage-wise you know, wages going up. It's just not, you know, none of it. It all looks bad to me. Can only end up in failure anyway, eventually. But they're hoping they won't be around then, you see. So, yeah, so that's health for you. And I think it's all headed in the wrong direction. And if, you know, like Richard Branson's bought various contracts and was complaining because he didn't get others, what's all that about? What's he going to do? Is his plan to suddenly start reducing prices for stuff? I don't think so. You know, he's a businessman the same as everybody else. That's why he's where he is. Through not necessarily through ripping people off, but sort of in the back door. You know, trying to sort of get control. So yeah, don't think there's anything else. Like to hear from you. Basically, I'll be updating. We'll get the usual couch. People who don't know anything, adding their 3 pence worth. But believe me, we got thick skins here. We don't care. Yeah, we'll just ignore you basically. So we want real, qualified people talking. Some say that the old matron system, whereby a matron was in charge of a ward of nurses, and she was the one who hired and fired, and anything above her, apart from the people supplying the equipment and the drugs, was irrelevant. But now you've got a manager for this, you've got a person to make sure that's right, you've got a budget person, you've got accounts people, you've got all these other people. Okay, you've produced the jobs, but it's all unnecessary, you know. And anyway, we shouldn't be, in a money-free system, you're headed for 100% unemployment, whereby we're all in leisure. But I'll show you how to do that one day. If you read the UFO, it's Project X UFO Money. I haven't done it yet, so I've got to read the book again and make sure I remember everything before I do that. But basically, none of this should be done. You know, money is the big stick in the mud. Basically, that's what holds everything up. And if you've got more ill people, then they're going to be held up even more, and you're going to get the queues. So anyway, that's health for you. And even if you've got something that might help, you know, or you know a company that made something for 5 pence. Like, let's give you an example. The other day, a person who has got the contract to fill up all the alcohol dispensers in a particular hospital goes there once a week, make sure they're all full, or twice a day or whatever, make sure they're all full, and that's it. Now all he does is go up, open the lid and squirt the stuff in from a big bottle or whatever. He was charging £1,000 per fill up. Now how the hell do you get to the point where the alcohol stuff which you buy in bulk and getting there the fuel for the van, whatever, and then filling these things up, £1,000 per unit? What's that about? People taking the mickey. You know, they might have won the contract by saying, oh, I can fill each one up for £5. And he's put his prices up, you know. And then you think, oh, well, but the contract's 5 years. The next person who does it for £5 will join. Then he'll put the prices up. You know, when you've got somebody running their own little company, they can virtually do what they like. There's no caps. There might be caps in some of the bigger stuff. You know, there's all these little people all eating away at the cash. You know, like I said, you know who the nurses, obviously not, because they don't get paid much, but you know who the top people are in the hospitals just by the big cars and the big houses. You see doctor on a letter, you go up to the house, oh my God, he's got Ferrari there. There's the garage open. He's got 2 cars in there. His wife's got 3 cars. You know, massive house. Don't need. And you put the letter through the box and walk away. So yeah, there's a lot of Mickey taking going on, but it's not really Mickey because it's still inbuilt in us to get what we can, you know, to operate for ourselves only. That is still with us. But when you've got a no money system, that all goes out the window, because you get all your food, your accommodation, your transport, your mobile device, all free, and nobody wants you to work. You could just sit at home. I don't know what that was. So yeah, and then if you decide you suddenly want to go to a centre of excellence, say for instance for racing, horse riding, whatever, you just do something that you're qualified. You look at your mobile, oh, I'll just do that job. Go and do the job, and you get a percentage closer to going to your centre of excellence. If not, go straight there. So that's the centre of excellence system anyway, but I'll go into that in big detail later. So I think that's it. Right, thank you very much, and remember to comment.